Welcome to Protecting Our Elders by Preventing Falls, Part 2 of 2.
On today's show, Dr. Thai will talk about the reason an older adult may fall, what symptoms may result from such an event, and what actions to take after a fall to best protect a loved one.
There are many factors which may cause elderly people to fall, such as certain medications that they take, a number of medical problems, such as diabetes, high blood pressure, joint diseases such as arthritis of the knee or hips, spinal degeneration, neurological diseases such as Parkinson's disease, stroke, poor vision due to macular degeneration, cataract, just poor night vision in the elderly. All those above factors may make them fall or bang their head. These mild head injuries may not cause them great concern and are oftentimes forgotten. However, in this elderly population, a mild head injury can cause a minute bleeding at the surface of the brain, which can sometimes later form a large collection of liquid blood called chronic subdural hematoma. When this collection of old blood gets to be large enough to irritate or cause pressure on the brain, it may cause brain dysfunction, and if left untreated, it can cause a permanent deficit or even death.
Dr. Thai now provides an in-depth explanation of what symptoms a person with a subdural hematoma may experience.
A subdural hematoma may be completely asymptomatic in the beginning. The patient may not even remember having had a head injury. She may even sometimes have pain at the sign of the impact or a short period of time, or she may feel dazed for a few seconds, but then forget about it. But a few weeks later, or a couple months later, she may have a number of various symptoms, such as a headache, confusion, forgetfulness, speech difficulty, numbness, nausea, vomiting, crankiness, weakness of an arm or leg. All these symptoms are often neglected and ignored until they cause significant impairments, especially when the elderly patient does not have someone to share her concerns, or because she cannot readily access to a doctor for consultation. Because of all these symptoms caused by a subdural hematoma do not become manifest until many weeks or sometimes 2 or 3 months later, they are called chronic to indicate the fact that they have been present for a certain period of time. When a subdural hematoma is expected, it can be confirmed by a CT scan of the head. A CT scan of the head can be quickly done and does not cause any special preparations such as blood tests or injections. CT scan are less expensive, are more available, and more rapidly performed than MRI scans. Chronic subdural hematomas require a surgical treatment by a neurosurgeon. The surgeon drills a hole in the skull. Once the hole is made, we can see the dura where the surgeon will make an incision to allow the subdural fluid to flow out. Usually, the surgeon will leave a small flexible plastic tube to allow the rest of the fluid to continue to drain into a bag for a day or two. A more sophisticated technique is to insert a hollow screw into a small drill hole and connect the screw to a drainage bag. The surgeon will remove the screw after a day or two.